Well, October is Breast Cancer Awareness Month, and today is National Mammography Day. Connecticut's offering a new program to help out women who can't afford regular mammograms. The Public Health's Early Detection and Prevention Program provides breast cancer screenings at locations across the state for patients who don't have access, whether because of cost or lack of insurance. DPH Commissioner Dr. Manisha Juthani spoke about the program, saying in part, quote, "We have incredible medical services in Connecticut that specialize in detecting and treating breast cancer. If you're uninsured or underinsured, we can connect you with providers who will give you a mammogram at no cost. This is critically important and can save your life," end quote. Now, for more information on that program, visit fox61.com. And getting mammograms scheduled is certainly important. And tonight I'm joined by Dr. Diana James, head of breast imaging at Jefferson Radiology. So let's talk about getting screenings. It's really important,
Absolutely.
right? Yeah.
Super important. Early detection is key.
Okay, we hear that all the time.
Yep.
Like, early detection is key. Why is that important, and who should be thinking about that early detection?
So if you're turning 40, you should definitely be thinking about it. So now everybody agrees that age 40 is the age that you should start getting your mammogram. Now, if you have a family history of breast cancer, like a strong family history, mother, sister, you may need to start earlier, actually. So you should talk to your doctor, your OBGYN, or your primary care doctor. But everybody in general should start at age 40. The earliest we find the breast cancer, the less treatment and the more successful the treatment will be.
Okay.
Essentially.
Yeah.
Yeah.
Okay. So now, what does a mammogram entail? Like, walk us through the process. If someone for the first time hasn't been, what can they expect?
So you're going to be asked to go into a room where there's this giant mammogram machine, which makes a lot of sounds, initially when it's taking the imaging. So it may be a little bit daunting, but we'll take 4 views, 2 of each side, each breast, and the total imaging time is 1 minute. So it's literally 1 minute can save your life. If we find something that needs to be treated, it's not a long period of time. There is pressure involved with the mammogram, so I've had it myself. It's not comfortable. I'm not going to say, oh, it's a piece of cake. It's really not, for us to get the best images possible, because our goal, honestly, we're pushing the resolution of imaging to a point where we can find breast cancers that are smaller than 5 millimeters, which just, for those of you that don't know the metric system, that's less than 1/4 of an inch. So if you think about the eraser, the end of a pencil, smaller than that. That's the goal. That's what we can actually find and detect these days.
And that might lead me to my next question, though. There's 3D mammography. Can you explain what that is?
So that is a technique that we've started, and I have to say the state of Connecticut has been so supportive of this breast test technique. We know from data that was published kind of in the 2018, 2019, that this technique can increase cancer detection rate by 40%.
Oh, wow.
So the technique to the patient, there's nothing different. You kind of go into the machine and the machine takes the picture. But for the radiologist, the 3D imaging part, we look through the layers of the breast tissue, and that's how we find little tiny cancers. So.
And then what would you say to a woman who might be a little bit on the fence about getting that screening?
I would say go with a friend. Find a friend, go with your mom, go with your grandmother, go with your cousin, sister. It's pretty easy to schedule the appointments together because they're only 15-minute appointments. So go for that moral support, definitely. I would also say more than 90% of the time, you're guaranteed that your exam is going to be totally normal. There's going to be no issue. The odds are really good in your favor. That's going to be fine.
And when you think of other cancer screenings too, only a minute of your time of this actual screening, it's much easier than other screenings too, when you think about it. Yeah,
exactly. Like a colonoscopy. Not to say you shouldn't get your colonoscopy.
Not all,
but it's easier.
It's an easy one to check off the list. All right.
Yes.
Thank you so much. And of course, this is Dr. James from Jefferson Radiology. We appreciate your time, so thank you.
Absolutely. Thank you, Sarah, for having me.
Brett?